Hello and a warm welcome to this webinar all about supporting your child's mental health and wellbeing during lockdown. My name is Dr. Alison Tamari. I'm an educational and child psychologist working for the Xavier Catholic Education Trust. What will we cover in this session? So we're going to look first of all at the impact of lockdown on children and young people's mental health. Luckily, last time when we went into lockdown, we didn't really know what the impact was going to be. We could make some guesses, but we weren't quite sure. This time we've got the experience of the last lockdown and all of the research that was done then, which was a huge amount of research in a short time, to draw on to help us to think about how we can support young people and their mental health a bit better this time. We're then going to look at signs and symptoms to look out for. We're going to look at supporting the well-being of your family and also supporting children and young people who are feeling anxious. We're going to talk a little bit about screen time and the impact of screen time on mental health, because I know it's something that people really worry about and feel an enormous amount of guilt about at the minute, and hopefully what I say will give you some reassurance. And then I'm going to signpost you to some further resources as well. So you may have seen in the media about the impact of COVID and of lockdown on our mental health, and particularly on the mental health of children and young people. So I just wanted to go through some of the factors that may have impacted on children. For lots of children and young people, there won't have been any impact on their well-being. However, there are lots of reasons why it may have impacted on their well-being, and there's some of the things. This isn't an exhaustive list, but there's some of the things to think about in terms of how it's impacted on them. So the first thing is that there's been a huge amount of change, and change is something that is stressful for all of us, even when they're good changes. And when we have a huge amount of change all at one time, it can make us much less able to respond in a resilient way to those new changes. There's also been a loss of routine. So for children, they're usually used to being quite a rigid routine at school, and they may have gone from that to being quite a loose and unpredictable routine, or no routine at all. And that loss of routine can lead to kind of not feeling as safe, because routine helps us to feel quite safe. There may have been a change in sleep patterns, and we're going to talk later on about the importance of sleeping, being able to regulate those emotions. There has been a reduction in face-to-face social interaction. We know from the research that actually loneliness is something that really leads to poorer outcomes in terms of mental health. And when we think about those primary school children in particular, those kind of things like Teams and Zoom and ways that they would be able to now interact with people, it's so different, and the social skills that you are required for those platforms are quite sophisticated, and it can be difficult even for adults to be able to navigate that effectively. So for young children, if you've ever tried to do a Zoom with young children, it doesn't always work particularly well, and doesn't give them that same face-to-face interaction or ability to be able to play with other children in a way that they usually would do, because so much of their social interaction doesn't revolve around talking, it revolves around playing with each other, and so it's very different. A loss of relationships with staff and with peers, the fear of getting ill or spreading illness can be a huge source of anxiety, as well as the anxiety about parents or caregivers, particularly key workers, catching the illness. Emotional contagion is a huge issue, because obviously it's a very stressful situation at the moment for all of us as parents, trying to work and also trying to homeschool and all the other things that go along with family life, and also perhaps financial pressures and things like that. So there's a huge amount of anxiety and stress probably in most households, and that can then really feed into the children. They can really pick up on that. The pressure to catch up, particularly that was coming out of the last lockdown. There was a lot of pressure to catch up, but there's also a lot of pressure now to keep up, I think, for children, where there's work being set online and thinking, are they doing enough, and will their friends be doing more, and are they going to end up behind? There's a reduction in mental health support for pre-existing conditions, and also increased time online, which, as we'll talk about later on, not necessarily an awful thing, but it does open them up to more risk. So just to look at some research really quickly. So this is some research that was conducted during the first lockdown, something called the Co-Space study, which was a study that was done by Oxford University looking at the impact of lockdown on children and young people. And they did it over a time period, so they were asking for parents to fill in questionnaires several times between March and June. And they were looking at the impact of lockdown on the young people. So what they found was that there were different results for different age groups. What they found was that for primary age children, the parents reported increased emotional difficulties, behavioural difficulties, and restlessness and attentional difficulties. Possibly they felt that could have been impacted by the fact that they weren't having the opportunities to play and to have that same social interaction and the interaction with their peers and their teachers as they had done before. However, when you look at adolescents and their results, they were quite different. So as well, they also had the increased restlessness. But there was no change in their behaviour, and actually their emotional difficulties, which would be things like anxiety and low mood, decreased. And they felt that perhaps that was because there were sort of decreased academic pressures for them, and just the pressure of being in the school environment, and the sort of timings of school and the pace, and being able to have a bit more autonomy over how they work was something that actually impacted them positively. Adolescents, when they were asked themselves, they didn't think that they'd changed at all. They didn't think they'd had any impact on them. And then when we look at children with SEN and mental health difficulties, actually for them, again, the emotional difficulties, the anxiety and low mood had decreased. Possibly because, again, being away from that school environment, being away from the stress of school and the sensory environment can often be a big stressor, especially for children on the autistic spectrum. And so being at home in their kind of comfort zone and in their bubble was something that was actually quite positive for their well-being. However, what is really worth noting is that whilst these were the changes that were seen overall, the impact was quite different for different people. And there was particularly a negative impact was greater for children from disadvantaged backgrounds, from BAME groups, and for those who have critical worker parents. So on now to some signs that your child might be struggling. I'm not going to go through any of the really, really obvious ones here, but I am going to talk about some of the more subtle things that you may miss and that can be quite important indicators. But equally, some of these are also very normal behaviours that within the holistic picture of your child that you have might not be a cause for concern. So these are just some things to have a little think about. So avoidance is often something that we see in children who are experiencing anxiety. They want to avoid the things that are causing that anxiety. Headaches, feeling unwell, and stomach aches all can be have a physical cause, but they can also have a psychological cause as well. Restlessness, difficulty sleeping or sleeping too much, difficulty concentrating. But again, we know from the Co-Space study that actually primary children's parents and secondary age parents all noticed that their children were less able to pay attention and engage with things. So it's not necessarily a huge worry, but it's just something worth bearing in mind. Changes in eating habits, unexplained outbursts, being irritable, which again, very normal for teenagers, but within the whole picture is something to think about. And finally, withdrawal. So if they're really withdrawing, not seeking to connect with other people, starting to lose interest in things that they would have been interested in before, they're all things that, that could be signs for concern. We're going to talk now about how to support their well-being during lockdown. So some really basic things. Structure and routine provide us with feelings of safety. And if we feel that life is quite consistent and predictable, then we're more able to respond in a more resilient way when we have adversity. So structure and routine is key. They've obviously lost their school timetable in lots of ways. I think some of the lessons that are being given by schools really help to try and bring some of that routine back. But if you can have some consistent structure and routine at home, then that's going to really help them. And I'll show you in a few moments some examples of how you can do that for different age groups. Exercise, play, and free time. Again, these things can really go out the window when you've got all of the demands of your work and of the children's academic lessons to try and fit in within the day. But exercise is so important for releasing stress and for releasing those endorphins, and also just time to play and have that free time, because a lot of the time at school they also have that built in. So make sure that that doesn't go amiss, because that's very, very important. Having quality time together, limiting access to the news. I think sometimes we don't realise when we're listening to the daily updates and things that it can feel really quite scary, I think, for children listening into that and hearing about how many people have died that day. It can make them feel quite anxious. So just making sure that they don't have that access to the news, and that anything that they do have is kind of given to them in a really age appropriate way. And things like Newsround can be really good for that. Making sure that you have time each day to reflect and focus on the positives. We know that developing those kind of happy habits of writing down 3 things that have been positive about the day, or 3 things that you're grateful for, if that's done over a period of time, that can have a really good impact on your mental well-being and your happiness. Maintaining relationships, so giving the opportunities for them to still connect with their peers, their teachers, and also with you. Because it's quite hard, isn't it, that transition from being a parent into also trying to be a teacher, and actually they need you to still be their mum and dad, and they need to have really nice time with you as well. And finally, looking after yourself, because as I said before, that emotional contagion, if you're stressed, they're going to feel really stressed too. So taking that time to look after yourself is in no way selfish. It's just very necessary, and it's also showing that you're being a good role model and showing them the kind of things that they can do to support their own mental health. So I just want to draw your attention to the right hand side of the screen. This is something called the Healthy Mind Platter, which was developed by Dr. Dan Siegel, who's the author of quite a few books that you may have seen, like The Whole Brain Child. And this, within, basically, he took the idea of how we know what would be on a healthy plate of food. We know that we'd have some carbohydrates and some proteins and fats. But he thought, actually, people don't know what you should have in a day to kind of maintain your mental well-being as well as your physical well-being. And these are the things, based on the evidence, that he suggested that we should try and have in each day, not necessarily in equal portions, but just things that we should try and get into each day. So focus time, doing something like schoolwork or something that has kind of an end goal. I think when we don't have that, we feel quite aimless, and that can have an impact on mental health. Sleep time. Sleep is so crucial for allowing us to be able to regulate our emotions. I know we've all had experience of not getting enough sleep and then feeling a bit more impatient and a bit more tetchy the next day. But it's the same with anxiety and feelings of low mood. Much more difficult to regulate when you're tired. So that's a key one, especially for those that adolescent age group. Having physical time, out doing exercise, connecting time. We've talked about connecting with others. Also connecting with nature comes into that one as well, so going out for nice walks. Luckily that's about all we can do at the minute, so that's quite a good one. Having some time to play. And then I just want to mention these last 2, because these are the 2 that often families don't have time for or make time for, but are quite important. So time in is time to sort of reflect on your day, maybe some time to do some mindfulness. And then downtime is just time to try and do absolutely nothing and just allow your mind to completely clear is an important one as well. I always use the example of when we're on holiday and we're lying on a sun lounger and we're doing absolutely nothing apart from just lying there, and it feels brilliant, doesn't it? And it really recharges us. But we don't really make time, or lots of us don't make time to do that usually. If we have any kind of second where we're not doing something, we immediately would reach for our phone or do the cleaning, find something else that we feel we should be doing, and actually downtime is really key. So it's worth having a look at this and just thinking about you and your family and your children. Which ones of these do you think, yeah, we definitely have those in our day, and which ones do you think actually we don't make time for them and maybe we should make more for? So these are just 2 examples of how you can structure your day depending on the age of your child. Different ones will be more suitable for you. If you have a look on the internet, there are loads of these available, and they can just be quite nice. There's ones like this daily planner, where as well as saying all the things they need to get done that day, they've also got things like things that they're grateful for, which encourages that time in that we talked about in the last slide. The one on the right is much better for really young children, where they can start to kind of build in structure to their day, and they can also have a bit of a say then, especially if you cut these out and maybe stick them with blue tack up on the wall or whatever, so that they can move them around and have them in an order that they're happy with, keeping it fairly consistent, but also giving them that autonomy will help with those feelings of control and feelings of safety. So these resources are to help you with that time in that we talked about, that's so important, and that many of us just don't bother with. So on the left hand side here, you've got something called the Happy Self Journal. This one's best for sort of key stage 2 to key stage 3, and each day it gets them to think about their top 3 things, as well as other different things each day that are all based on positive psychology. So that's a really nice one. That's about £20. There are also ones that you can buy for kind of secondary age children that are better. However, with that one, obviously that's quite expensive. I think it lasts for about 3 months. If you don't want to buy one like that, you can also just print off things like this from the internet quite easily that are lovely. I'll put all of the links to all of these things below in the comments. But this is a nice one. It gets them to think about things that they're grateful for that day, but equally just a notebook that they keep by their bed, and same with parents as well. It's a good thing for everybody to do. Just having a notebook there where you note down each day, make it a habit to write down 3 good things that happened that day. Because what happens is over time it becomes a habit. So rather than having to think, you might find that the first night you try and do it, it's quite difficult to think about what good things happened that day. Over time, by making that habit, you'll start noticing automatically the good things that happen in each day, and that can really boost our happiness levels. And this can also be something that's quite useful to think about. So this is something called the spheres of influence, where we think about what the things are that we can't control and what the things are that we can control, and we focus much more on the things that we can control and try to let those things that we can't control go. So things like other people's behaviour, how others react, how long this is going to last, all of those things are out of our control and not very helpful to get fixated on. However, things that are in our control, that will give us those feelings of control, which help us to feel less anxious, are finding fun things to do at home, keeping yourself safe, looking after yourself, and washing your hands, keeping in control of your own social distancing. So they're much better things to keep control of and to encourage children to control. I also wanted to share this with you because often people talk about self-care and the importance of self-care, but we often don't really know what that means, or think, actually, I don't have time for self-care because I've got everyone else to worry about and everyone else to look after. I haven't got time to look after myself. So these are just some examples of how you can take a break. Some of them are really short things that don't involve much time at all, but just to give you some ideas of the kind of things that can be really useful for just emptying that stress bucket and helping us to regulate our own emotions so that we can then contain the emotions of our children, our families. We're going to move on now to some strategies. If you feel that your child is feeling anxious and you want some strategies to support them, then this would be a good place to start. So the very first thing, often as adults and as parents, we love them so much, we want to help, especially when we see that they're feeling distressed. So often we try to give advice and we try to find solutions, and actually if you think about what you need when you're feeling stressed and worried or sad, actually what you want is just somebody to listen, and sometimes taking that pressure off your shoulders as a parent, that you don't have to come up with the solution, you don't have to fix everything. Actually going in and fixing everything can be quite disempowering. So the best thing that you can do is listen, empathise with them, even if it's something you think that they needn't be worried about. Just empathising with them and saying, yeah, I would feel worried too if I felt like that. Validating, it's all completely normal to feel that way. Normalising their emotions, making them feel that actually there's nothing wrong with them. There is nothing wrong with feeling anxious. Anxiety is a completely normal and useful emotion to have. When we start to feel anxious for the majority of the time, obviously that isn't a useful emotion, and that's where we might need some more support. But just normalising that feeling, especially as it's a very normal response to the completely abnormal situation that we find ourselves in at the moment. Labelling the emotion can really help, especially with younger children and with older children as well, actually, because often anxiety has quite it feels quite physical. So often children might be saying that they're feeling sick all the time, or they've got tummy aches all the time, or their head's aching, or their chest's hurting. Lots of those things can feel quite physical. So actually being able to label that emotion for them and use words that they would use, especially for the little ones where anxiety isn't really part of their vocabulary yet, but using words that they feel comfortable with using and just giving a label to that emotion so that they can express it to you. Is really, really useful, because once we label the emotion and put a label on it and say, I'm just feeling quite anxious, just by doing that, it can reduce the intensity of that emotion. So labeling the emotion is a really important one, and helping them to recognise what those feelings are. So often another thing that people do is get them to draw where they're feeling the worry within their body. So it might be that they kind of draw squiggles on their tummies, or squiggles in their brains, or that their arms are shaking or their hands are shaking. So you can get them to draw it out for you, just so that they start to recognise that when they have those feelings, that is just anxiety. And that brings on to breathing techniques, because the thing with anxiety is that it's the body's response to, it feels that there's a threat, and so it's our body's response. So we also kind of call anxiety the fight or flight response, which is where it's really useful when there is a real threat. But when there isn't a real threat, it's not very useful. But the way, just as the brain tells the body that we need to get into that fight or flight to be able to survive, the body can also send messages back up to the brain to tell the brain, actually, this isn't a life or death situation where I need to fight or flight. And the way that you can do that is by taking lots of deep breaths, because that tells the brain that we don't need to worry about it, we don't need to respond in that way. And here are some really nice breathing techniques to use with children. So with young children, you can think about doing things like smelling the flowers and then blowing out the candles. That can be quite a good one for them. There's also one here that I've put on there called finger breathing or hand breathing, where for any of them, wherever you are, you just trace up a finger, get it on the screen, trace up the finger breathing in, and then breathe out. Breathe in, breathe out. And obviously you do that quite nice and slowly, because what you want to do is slow down that breath. And by the time you've done that on both hands, you can do that several times. But that's quite a nice technique for them, because it can be quite subtle. They can do that without anybody really noticing what they're doing, but it gives them quite a nice cue to help them to ground themselves and to do that breathing technique. Another one that I've got a picture of here is something called square breathing. And this is a really good one, because it encourages them to distract themselves, which is a really good technique when you're feeling anxious. But it also encourages them to slow that breathing down as well. So the idea is that any room you're in or anywhere you are, you can always find something that's a square or a rectangle. And then you look at that square and focus on it, and then you may want to trace with your finger, or also you could just do it with your eyes. But trace up and breathe in. Across, hold your breath for 4. Go down the square and breathe out. And then hold your breath again for 4. And then you would just keep doing that until you've calmed down and helped your nervous system to regulate itself. Mindfulness is a good one. And again, it's one of those things that really, to get the benefits of it, you need to practice it quite regularly. There's lots of apps out there, things like Calm or Headspace. Headspace is a really good one for children, I think, because it's got animations that really help to explain the whole process of mindfulness. So it's good to practice those every day, just doing something short every day and practicing, because the point of mindfulness is to practice being in the present moment, because the idea is that actually in the present moment there's usually very little to worry about. Usually we're worrying about things in the past or things that might happen, what ifs for the future. So if we can focus on the present moment, usually that can be really calming and grounding technique. And then the final one to talk about is something called thought challenging. So thought challenging is based on something called cognitive behavioural therapy, which is one of the main techniques that therapists would use to support children and young people with anxiety or low mood. However, you don't need to be a therapist to use some of the techniques from it. And the idea is that often our thoughts are often they're automatic and pop into our heads automatically, and often they can be quite negative, and often we take them to be facts, and they're not always facts. They can be things that our brain is telling us that actually aren't true and aren't realistic. So if we can help children to challenge those thoughts, and not that we want to be challenging those thoughts and telling them how wrong they are, but just asking the right questions to allow them to challenge their own thoughts. So just to think a little bit more about thought challenging. So it comes from CBT, and the crux of CBT really I've shown you on the left-hand side here. So it's what you think, and those negative thoughts directly impact on how you feel, which then impacts on what you do and your behaviour. So just to give an example here, a COVID-related example, it may be that you have a child who's thinking, if I catch COVID, I will die. That might be the negative thought that they're having. Obviously, that's going to lead then to feelings of anxiety, and then that might lead to behaviours like avoiding any kind of leaving the house, even for a walk or anything like that. Something that would be COVID safe, they might be completely still avoiding because they are so anxious about it. And so we need to think about how we can challenge that negative thought, because if we can turn that thought to something a bit less negative, then we can help to reduce those feelings of anxiety. So some really good questions to ask. There are lots on the right hand side there. I'm not going to go through all of those, but if you want to pause and have a little look at those, then that could be good. But some really key ones are things like, what is the evidence for my thought? Because often they're based on something, and in this situation it's a very understandable fear to have. So what's the evidence for my thought? What is the evidence against that thought? What would I say to a friend who was worried about the same thing? And what might my friend say to me if they realised that I had that thought? And all of those can lead to them coming up with a more balanced thought. And if they can have a more balanced thought, it's going to reduce those feelings of anxiety. And I think this resource is a really lovely one to help you with those conversations about anxiety and to help you to try and help the child to solve it for themselves. So things to say to them: do you want to do some running or dancing around to get rid of some of that worried energy? So encouraging that exercise. Tell me about it, encouraging them to talk and showing them that you're there to listen. What would you like to say to your worry, and what might your worry say back? And then what? And that can be really good because it's externalizing the worry and talking about the worry as a separate entity, which is a really good technique. Asking them to draw their worry, which we talked about before. What does it feel like in your body? Where is the worry? How big is it? Match your breaths with mine, so helping them with those breathing techniques. Let's think up some endings for what could happen. So thinking, often what we do with worries, we say what if, and then we have the worry, and then we never actually answer that question. So helping them to think about some endings of what if. Often the what if isn't as bad as the not answering that question. So think about some endings for what could happen, some anxious ones, some goofy ones, some realistic ones, and also what's something that we could do to help you feel better. So again, helping them to solve their own problem is really, really powerful. There are now some amazing resources out there to help you with this, because it's not easy, and these are some really brilliant examples. So there's first aid for feelings. That one's brilliant for primary age children. Again, I'll put all of the links below in the comments for these so that you can access them. That coronavirus anxiety workbook in the middle, that's really good for both sort of teenagers and adults, although what you might find is that teenagers prefer to use an app, and I'll give you some links for some apps at the end. And then there's also your self-help survival guide, which is a really nice one for parents to use. And as I mentioned before, we're going to talk a little bit, just to end on a note, about screen time, because I know lots of parents are feeling really guilty at the moment about screen time and worried about the impact that that's going to have on their children. So I just wanted to share with you some of the research on screen time and mental health, the impact it has on mental health. And actually it's a really mixed picture, and I think actually screen time, which is why I put it in inverted commas, it's not really a very helpful measure. Because it's not about whether a child is having 2 hours or 3 hours or 4 hours, and that 2 hours is fine, but suddenly 3 hours is really bad. It's more about how they're using that time, because actually screens now help us with so many things that are really good for our mental health. So just as I said to you about communication and connection and how important that is, screens are allowing us to do that at the moment, so it's good. They're allowing us to have that focus time. They're allowing the children to carry on learning in a way that they wouldn't be able to otherwise. They can also increase mood. I know when I watch television, watching a program that I like, it increases my mood as I enjoy doing that. So screen time isn't necessarily a bad thing. I think what is more important is how screen time is used. So for example, some research shows that with social media, for example, if you just scroll through a Facebook feed or an Instagram feed, that can have a negative impact on your mental health. Whereas if you actively engage with it and interact through that medium, it can have a positive impact on your mental health. So it's really not a clear-cut picture of some being too much and some being not enough. When it can be a problem, and they put these on the right-hand side, if they're having so much screen time that it doesn't allow them to have that healthy mind platter and all of those things that are within that healthy mind platter, if they're not able to have time to connect, or they're not having enough sleep, which is often an issue with teenagers where they're up until late at night playing on computer games or whatever, so they're not getting enough sleep, that's when it's more of a problem. So is it causing reduced physical activity? Are they not getting out and doing any exercise because they're having too much screen time? Are they not connecting? Are they not sleeping enough? And also just kind of observing yourself, is this having an impact on their mood or behaviour? Do they seem more down when they've been playing computer games for a long time? In which case it's definitely something that might be worth stepping in and trying to monitor a little bit more closely. So finally, I hope some of these tips have helped you with knowing how to support your children at home. But if you are very concerned, contact school to discuss your concerns. Contact your GP, who may be able to refer to CAMHS if needed. And also CAMHS have an advice line in Surrey, so and the number's there for you, so you can give them a ring on weekdays. So finally, I just want to leave you with a list of resources and websites and apps to have a little look at. As I said before, there are so many great things available that I haven't got space to put all of them here. So instead, I've tried to direct you to places where they have all of those resources for you. So first of all, the Childhood Bereavement Network is brilliant if you unfortunately find yourself in that situation, or if somebody is in hospital sort of critically ill, they've got advice for you for supporting children through that. Every Mind Matters is a brilliant website. Bernardo's, Surrey CAMHS have got some excellent things on their website as well to support you. I've put the eating disorder charity Beat on there because one thing that has been really noticeable through lockdown nationwide is that there's been quite a dramatic increase in eating disorders. So that's there for you if you should need that. Samaritans are brilliant if you are in a crisis and need somebody to call. They are available 24/7 on that number. Coos is a really good website where children can get online support, and the Mix is quite a similar one, and they've got a phone number there for you as well. As I said before, some young people would prefer to use apps rather than paper kind of booklets. A really, really good one is called Wiser, which is for 13 years and up, and that uses chatbot technology to as kind of like a coach for children, support them through anxiety or low mood, self-esteem. There's lots of things on there about sleep as well. The Silver Cloud Toolkit app is really good, CBT-based app for children aged 16 and above. And then finally, Calm Harm app, which is an app for young people who are self-harming. So thank you so much for listening, and I hope it's been useful. As I said before, I will leave all of the links to all of the materials that I've talked about in the comments below. Thank you.